The official death toll is 60,000 people, and there's a massive disparity there.
However you might call it pandemic or endemic, the virus is not gone. It still causes a number of infections and also deaths. And so we have to watch the situation closely.
那没办法，新冠肺炎死了多少人了？你不知道。就那个，我在抢救室，在奉贤，包括在这边，我昨天来了一天，就好像看到死掉了5、6个人了吧。
Hey there, what's up? I hope you are doing good and away from the clutches of the new COVID variant. Wait, what? There's COVID again? Sadly, yes. China is going through a havoc, and different regions around the globe have been experiencing new cases. I know, this is a bit overwhelming, but it is always an advantage to stay aware, and in this video, we will give you all the updates you need to assess the current COVID situation. In this video, we will talk about the COVID chaos in 2023. Omicron and its subvariants have been dominating the scene for more than a year now. And though the highly contagious Omicron variant came in with a fury, cases and hospitalizations eventually dropped and evened out by the fall of 2022. If Omicron and its descendants continue to reign, it's possible that COVID-19 becomes a more predictable seasonal illness, similar to the flu and other human coronaviruses that cause cold-like symptoms. However, if an entirely new, more immune-evading variant of the virus, one with its own Greek letter like Delta or Omicron, makes its way to the top, we could see another surge of illness no matter what time of the year.
Over the next 4 months, we expect a huge wave of the Omicron variant in China. Most of them are susceptible, so there's really nothing to stop it once you take away zero COVID.
So, what's the new variant? Well, the coronavirus strain everyone is watching right now is XBB 1.5, which is a close relative of XBB, a recombinant or hybrid of two BA.2 sublineages. About 40% of confirmed US COVID cases are caused by the XBB 1.5 strain, up from 20% a week ago. XBB 1.5 may be more transmissible than others, but it's not yet known if it causes more severe diseases than the previous strains.
In the United States, it's about 40% of all COVID cases are caused by this variant right now, although in our part of the country, it's only 6% of cases, so we're going to see more of it.
In 2020, we knew very little about the novel virus that was to become known as COVID-19. Now, as we enter 2023, a search of Google Scholar produces about 5 million results containing the term. So, the big question arises. Will there be a new variant of the virus? Well, there's no certainty that new variants will emerge that have an effect in order of the Delta or Omicron, but it is possible. So what's the COVID chaos in China? Well, Chinese authorities have warned of successive wars of COVID infections over the coming months.
In the last few weeks, it's been doubling almost every week,
as cases continue to surge after lifting of restrictions earlier in December 2022. Wu Zhanyu, the chief epidemiologist in the Chinese Center for Disease Control and Prevention, said that the current outbreak would peak through winters and run in 3 waves for other 3 months. Wu said the first wave would run until mid-January. A second wave would likely follow soon after, being triggered by the mass travel of hundreds and millions of people across the country for the Lunar New Year starting on the 21st January. He predicted a third wave from late February to mid-March after people returned to work from the holidays. Residents in China are reporting countless cases of COVID around them, despite the official count being just around 2,000 a day. Last week, the National Health Commission conceded it was impossible to keep track of the asymptomatic infection and it would no longer be counting them. The removal of mass testing and reduction in mandatory tests means fewer people are getting tested and it's all out there running free. How will the pandemic be felt in 2023? This question in some ways is impossible to answer, given a number of unknowns. In early 2020, the scientific community was focused on determining key parameters that could be used to make projections as to the severity and extent of the spread of the virus. Now, the complex interplay of COVID variants, vaccination, and natural immunity makes that process far more difficult and less predictable. The proportion of people estimated to be infected has varied over time, but this figure has not fallen below 1.25%, or 1 in 80 people in England for the entirety of 2022. COVID is very much still with us, and people are being infected time and again.
They're the ones who've had the most cases of this XBB 1.5. So as we see what happens there over the next week or so, that should give us a better glimpse about what we should expect.
But why have the COVID projections become harder? Well, during the early days of the pandemic, simple models could be used to project the number of COVID cases and the likely effects on the population, including demands for healthcare. Relatively few variables were needed to produce the first projections. That was because there was one main variant of COVID, the original strain, to which everyone in the world was susceptible. But now, those simple assumptions no longer hold. Much of the world's population is estimated to have had COVID, and there are significant differences between individual levels of protection in terms of which vaccine and how many doses people have received around the world. In total, 13 billion vaccine doses have been administered, but not equitably. A reduction in surveillance also makes modeling more difficult. During the peak of the emergency response to COVID-19, this was a priority, including surveillance of people with the virus and surveillance of variants. This allowed new variants such as Omicron to be identified early and responses to be prepared. The UK in particular produced 2 million COVID sequences up to February 2022, accounting for 1/4 of the world's genome sequencing output. But sequencing activity has subsequently decreased, which may increase the time it takes to identify new variants of concern. And how's India doing amidst all this chaos? In India, 11 Omicron subvariants were found among 124 international travelers who tested positive for COVID-19 between December 24th and January 3rd. They said 19,227 international travelers were tested at airports, seaports, and land ports in the said period, and 124 of them were found COVID positive and put in isolation. So, is the pandemic over? Short answer, no. There remain big differences in pharmaceutical and non-pharmaceutical interventions in places around the world. For example, the use of masks, COVID testing, and building ventilations. As governments loosen and at times retighten their response to react to dynamic medical and social pressures, there is a risk that variants could emerge which evades some of the defenses that populations have built up. The next stages of the pandemic will also be influenced by people's behavior. For instance, how much we work from home and whether we reduce our social contacts when infectious. There's no certainty that the new variants will emerge that have an effect in the order of Delta or Omicron, but it is possible. So, what's next? Honestly, it's hard to say. During the previous wave of the pandemic, we've often seen short-term national interests prioritized with a focus on national response to vaccine equity, while discounting the long-term global availability of vaccines. While initiatives such as COVAX were established and conceived to provide equitable access to COVID vaccines and treatments, the challenge is to design incentives for nations to cooperate to reduce long-term global risks. It seems like we will not have the larger picture until the variant decides to put on a full show. So until it's dormant, let us all pray for it to remain that way and cherish the days of lesser chaos and lesser fear. On that note, let us also cherish our beautiful Vault of Vokes community. We are happy to start our new year with you, and we hope this year brings us more curious viewers. As for you, you can contribute to our channel with 4 simple steps. Subscribe to our channel, like our video, comment your views, and share them with fellow enthusiasts. And until we meet next, stay awesome, stay curious. Vault of Vokes signing off.